I could recommend our University of Louisville Developmental-Behavioral Pediatrics program without reservation to fellows because it offers diversity of population, an interdisciplinary approach to evaluations, opportunities for consultation with other pediatric subspecialties, and we have a wonderful culture of respect and camaraderie here that I don't think we could find in most other places.
The benefit for fellows is that they get to really make a mark and really get to be part of the process of creating something that's more refined, that's newer, that hasn't existed before. We're currently in the process of working really closely with other service lines that affect developmental children. We work really closely with psychiatry, the general psychology team, with the autism center, and the vision really is for these systems to be working really smoothly together. And for me, it's very exciting.
I think medicine is an art, and developmental pediatrics captures the beautiful marriage between science and art. And our program captures that while still nurturing your medical expertise as an individual.
I decided to rank University of Louisville Developmental Behavioral Fellowship high on my list. It was clear that the culture of the program allowed you to have autonomy, but you also were learning from many different professionals. The center here is focused on an interdisciplinary approach when it comes to evaluating patients, and I knew that would be really important for my training as a developmentalist.
The common theme in all the LEND programs is to improve the care to individuals with autism and other neurodevelopmental disabilities, with a really strong focus on increasing the capacity to screen and evaluate. What makes the Kentucky LEND really unique is that it really seeks to train trainees to become leaders in the field, to advocate for individuals, to support caregivers and families of. And so fellows work in collaboration as a LEND trainee. It's a stipend-supported traineeship, and so the activities for the LEND really mirror and run in parallel with the fellow activities.
So I think it's a program that's nice that can be kind of personalized, right? Developmental pediatrics is a pretty big field, and within it you can have a lot of different areas of interest. And so I think here it's nice that you can figure out those areas of interest if you don't know them, and to really get more kind of training and even research in those areas. So there are lots of different places that you can kind of focus on, as well as just getting a good general education.
So I came into fellowship with a big passion for resident education, and I was excited to learn that with fellowship I would be able to continue that passion by developing lecture, by teaching residents while they're on the rotation with development, working closely with the attendings to make our rotation better for residents. And as a fellow here, you will have an opportunity to kind of create your own path when it comes to education. It's really up to you what you make it out to be.
We really have a wide variety of didactics. We start off with having the fellow have a good understanding of what typical development is.
I think we do a nice job here of getting kind of focusing in that first year on your kind of foundation, of development, and really focusing on time in developmental clinic, and again, kind of seeing lots of different kids of ages and abilities and concerns to kind of get that general focus in, and then do some of the more subspecialized things and focus on more areas of interest in the second year, and then in the third year to have a lot more time to get that research piece done. So hopefully by then you've figured out what you're interested in and can really focus on that and get it done during that time.
We have a really great team here at University of Louisville. I think all of our clinicians have different areas of expertise, and so we frequently collaborate with each other. When we have patients that we may not fully understand what is best for them, we can always talk with each other and consult on a regular basis.
It's really nice that you can walk down the hall and talk to anyone who's caring for a patient and discuss what they see and what you see and where you think things are going, and if you all think that there's a referral that needs to be made. We're all on one team. We're all working for this one kiddo, and I've never been anywhere else like that. I've been a lot of places.
We have faculty that are incredibly supportive and dedicated to training, so our passion for training is kind of innately a way of supporting our fellows.
You know, this division really wants you to participate. And I think that's really important, that as a physician that you not only participate in patient care, but you can also participate in what that care may look like, what that clinic workflow may look like. And I also think it's also very important that you work with other disciplines.
We have a really interdisciplinary division with lots of different disciplines all interacting together, and it's really awesome that we're able to train in such an environment. So all professionals across different disciplines have the opportunity to work with fellows, and fellows get a chance to see how different people interact with our population of kids with developmental disabilities.
In addition to speech therapy, occupational therapy, we have a fairly strong nutrition division with several dietitians who cover both general nutrition and also various specialties.
It's a very beautiful space. I think it has a very bright atmosphere. It has sufficient space for us to do our physical exam and interact with the kid, help him or her become comfortable. We also have observation rooms where learners can observe and be able to see behaviors that will not necessarily be present if you are just directly taking history in the room with a patient.
We have patients coming from throughout the state of Kentucky and southern Indiana. There is no doubt that fellows, while they're here, will see examples of every type of developmental and behavioral problem and feel fairly comfortable working with those individuals. There are no two patients that are just alike, but you'll have lots of exposure.
Developmental Center is special because of the patients we see. We see kids for autism and ADHD, and for some of these parents, this is a new diagnosis. They don't know where to go. They're learning about everything, and you're the person that's going to help them, teach them that this is okay.
I found myself planting roots in Louisville because it's a small city with a big city feel, with also a community that is very welcoming and accepting.
It has the best open spaces, I think, of almost any city I've lived in.
They call us the Bluegrass State for a reason. The grass here is better than anywhere else.
We have a ballet, we have the opera, we have a great theater program.
It really has lots of great restaurants and lots of cool culture. I think it has everything that like a small city has to offer, but not too overwhelming.
And I tend to say Louisville has vibes because I just think it's a very unique city, and it offers a lot of fun things to do on the weekends, whether it be with your family or with your girlfriends, whoever it may be.
The central location makes it just an ideal place to live, to raise a family.
I'd love to be able to see us become one of the premier fellowship programs in the nation. We need people that are passionate about developmental behavioral pediatrics and are well trained in the skills needed in that area.